I'm at APHA today because I'm presenting on barriers experienced by persons with disabilities in the healthcare system. And I'm really excited by the opportunity because I understand that it's one of the first times that an entire panel has been dedicated to this issue. Science, action, and health. These are all very, very important issues for persons with disabilities. Let's think about science for a minute. Science is really important because it helps us understand what are some of the barriers that people experience. So getting the evidence, getting the science behind it really helps us design policies that are meaningful and speak to the issues that pertain to persons with disabilities. The other one is action. Action is really important because it means that we're talking about implementation. Too often I find in my work you have good policies, you have so-called inclusive healthcare systems, but the action is actually not taking place. And then there's a disconnect between the policy and what's happening at implementation stage. So those are all very, very important pieces that need to be considered going forward. So the best partners supporting persons with disabilities in the disability community, I think, are persons with disabilities themselves. I think it's really important to understand that there's a very large community of persons with disabilities, fairly well organized globally. And I think for anybody who's thinking about and working in the space of inclusive healthcare, they should be working with people with disabilities. So in my work at the World Bank, I work to include persons with disabilities in the design of projects. So bringing people in so that we understand what their lived experience are and what their needs are. But for the World Bank, our main interlocutors, so to speak, are governments. And so we work through governments. But I think when we talk about partners, we should be looking at the private sector. We should be looking at other development partners. We should be looking at think tanks and academia. We all have a role to play in communities. We all have a role to play to ensure that we have inclusive healthcare systems. So I think it's absolutely incredible that we're looking at the healthiest nation in one generation. But if we want to seriously do that, we have to recognize that persons with disabilities make up at least 15% of any given populations. And in some countries, like in the States, it's at least 20%. So we can't create the healthiest generation if we don't include this population. So there has to be a deliberate effort to ensure that it's accessible, it's affordable, and that it's available to all persons with disabilities, disabilities that are visible, but very importantly for people who have invisible disabilities. For next year's theme on preventing violence, what I would like to see is a very strong focus on looking at violence against persons with disabilities. We know from data that persons with disabilities experience disproportionate amounts of violence. And this is particularly the case for women and girls with disabilities. And so a gendered lens and a lens that looks at disability is really important when we think about violence and the various types of violence that people experience. I think when you look at disability, the types of violence that people experience are often linked specifically to their type of disability. And so it's really important to explore that, to analyze that, and for us to have a better understanding of how people with disabilities experience violence.